I'm recording now. So now
Yeah.
try and move the slides.
No. No, but when you click record, then
I'm in control.
you're in control.
You see, Lou? Can you see now? Try again now.
Yeah.
There you go. Okay.
Are we still recording?
We're still recording, but just go for it, and I'll see if I can edit the front end off.
Okay, then we start now.
Mm.
Hello, everyone. Thank you for having us. We are going to talk about what matters to you, the global movement. My name is Anders Vege. I'm head of section for quality improvement in the Norwegian Institute of Public Health.
Hello, and my name's Shaun Maher. I work in the NHS in Scotland, and I work as a policy advisor in government and also as an educator in quality improvement. And my policy focus is on person-centered caring and quality improvement, and my education and training role is around quality improvement and person-centered care too. And my professional background is as a nurse. I'm delighted to be here with you.
And I'm a nurse as well. So Gro, thank you for having us. We are really proud that you have invited us to share our experiences with this global movement on this very, very important conference. So thank you for that to you and the conference organizers. We are going to talk about how it all started, this global movement. We are going to talk about the Norwegian story, the Scottish story, the head, heart and hand as an approach to understand content of the movement. We're going to talk about how we went global and the real spread. And then we're going to end up talking about taking the message home and experience it at the very personal site. So this all started in 2012 when Barry and Edgemond Leviton wrote an article in New England Medical Journal about shared decision making. And it was a very, very inspiring one that Maureen Bisogniano, at that time president of Institute of Healthcare Improvement in Boston, USA, heard and read. And she came as a keynote to a conference in Orlando in 2013 talking about flip healthcare from what's the matter to what matters to you. And both Shaun and I was in that audience, and we were so inspired. And for me, it was extremely important because we had started the program in Norway, the KS, the membership organization for municipalities, and me, part of Norwegian Institute of Public Health. We had started the program to approach the challenges in cooperation and pathways for elderly and long-term condition. So we really fought a battle at that time. Every system is perfectly designed to give exactly the results it gives. It's Paul Batalden who said this for the first time. So many used this saying afterwards. But for us, it was a struggle for a mind shift in healthcare. We were working to improve the pathways for elderly and long-term conditions in Norway. And it was about the shift from asking what's the matter to ask what matters to you. And it was really, really not only about writing new procedures, checklists, routines, but very much about the attitudes and the values that you find in each and every one of us and in the systems and in the society. So this shift was something we worked in regional collaboratives. First in 14 and 15, we had 2 pilots, collaboratives. And then we started the real program in 16. We had a model framing good practice. We invited learning networks to build on local ownership and quality improvement culture. And we had improvement teams coming from municipalities and hospitals to our gatherings. Preparation before they started the learning collaborative, putting the patient's perspective in center, not the professional perspective. 4 times 2 days sessions in 8 months, and we did coaching between the sessions. So that's the framework for the work we did. And you can see by the map where we've been from 14 to 20, and we have started a long journey for the rest of the country now. So it's one collaborative, but it's 2 interventions. I'm not going to go deep into details here, but the pathway for elderly and long-term conditions, it's a framework, it's a structure for how you can work to improve and work on continuity, for instance, in the pathways for the services. That's the first intervention. The second intervention is the health promoting change of direction in healthcare. And you see here the badges we're wearing on What Matters to You Day, which symbolize the change of direction in healthcare. Here is the successful pilot that we build on. You have Tove Røsta's PhD, which is a great work, how they changed the structure of care in Trondheim and Orkdal region. And Anders Grimsmo, the professor, he is joining every session that we have in the collaboratives. So it's a very important part of our work. And we have this way of following up the pathways and see for each individual if we actually give the right and the good pathway. It's about prepare transitions from hospital to municipality, but also within hospital, within the municipality. It's about what matters to you visit within 3 days. It's about considered by GPs within 2 weeks. It's about follow-up and the evaluation within 5 weeks. And it's about early sign of change and of condition and what then. So we also introduce a second tool for measurements, and that's what called the patient-specific functioning scale. In Norwegian, we called it Hva er viktig for deg schema, or what matters to you form. And it's about putting what matters to you into a program and put up action to reach the aims that are the patient's aim, not our aim. So we talked about what matters to you with the teams in the first collaborative, and they were so excited, just as excited as Shaun and I was when we heard Maureen talk about this for the first time. And that was so strong. And they were so motivated to get back to their municipality and start change of healthcare in their own services. But then they came back on the second learning collaborative session and said 3 months later, sorry, but it can't be done. We have tried now, but people are really frustrated and they say it will create a tsunami of needs in our services. And some say the question is too big, it's not possible to answer for the patients. And here you see what happened then, because we said, well, it has to be done because this is the very, very important message in the change of direction in our healthcare. So we invited all the teams to join us in What Matters to You Day, 4th of June 2014. And that special day, we had so many stories told to us about how people really were surprised about the response to the question. And in Tynset, one of the municipalities, we had a doctor sitting on duty and in the nursing institution, and they had a meeting in the morning and they decided to wear the badges, and every patient should have the question, what matters to you this day? And so just a few minutes later, she saw coming in the door an old farmer she knew, 67 years old, and he was full of pain. And she could see immediately that the man she knew having the cancer in the lungs in the late autumn the year before really had become into the face of terminal care. And she thought immediately, we have to stick to the clinical issues here. It's about pain, it's about nutrition, it's about sleep, and the wife is completely worn out as well. But on the way to her office, together with the patient and his wife, she decided, well, I have to ask him as well. Excusing herself when the meeting starting, she says, well, we are part of this program in Norway, and we have decided today to ask all patients what matters to you, so I ask you as well. And this farmer, this very proud one, he started crying. And he started crying, and when he collected himself after a while, he said, you are the first asking me this question. You are the first to ask this question. And he answered to the question immediately, I want to spend one more night in our cabin. And I understood only some months later what he really meant with that. It was not going to an ordinary family cabin at the seaside or something. An old farmer works, sleeps, and eats. And the only time he has with his family is when they go to the cabin. So he told his wife, he told the family, I know I'm going to die. I would like to spend time with you. And that created a totally different healthcare. It was very much responsible when it came to pain, nutrition, to sleep. They organized so he could sleep in the institution in the night, but he went to the farm at daytime together with his family. And it was such a different story than if Åse Ingeborg Borgås hadn't asked, because if she went straight to the clinical issues, he would spend the last 3 weeks of his life, because he died 24th of June. He would spend all those days in a white institution room at the nursing institution, 24/7. But now he was with his family, and we got a beautiful letter from one of his daughters saying, thank you for responding with what matters to you, to my father. And this is the cabin he was talking about. So from that time, we understood that we had a gold mine in this question. So now over to you, Shaun.
Anders. So in Scotland, we had a similar sort of experience, and we were working independently from one another. Anders and I hadn't really connected at this point. But we had a group of people who took this challenge away from Maureen and started to think about how we could put it into practice. And we were people who had done some quality improvement training. So we'd learned about how to do improvement in healthcare systems. From much of the teaching was from this man, Edward Stemming, who's on the screen here now. And what it did was it made me think of this very important saying from Edward Stemming. He said that the greatest waste in any system is failure to use the abilities of people to learn about the things that are really important to them, the things that really matter to them, their frustrations, the things that bring them joy, the things that they want to try and improve in their life, or the things that they want to do more or less of. And I think that this "what matters to you" question brought this home and humanized it perhaps more than we had realized up until this point, that this was the thing that we were trying to do. And what the "what matters to you" question did for us was it gave us this space to listen. It gave us an opportunity just to pause and to focus and concentrate on the person who was in front of us. And that was really important to us. And like Anders, we started to discover all sorts of things that we didn't know, things that we would never have known had we not asked the question. And I think this is the challenge that we often have, that we are so highly educated and we are so used to doing the things that we do, we forget there's still lots of things we don't know. We don't know about the unique circumstances of this person who's in front of us, the farmer and his hut and the things that really mattered to him. We knew all about his pain, we knew all about his cancer, we knew all about which drugs could help with this or that. but we didn't know what was right for this person who was in front of us. And I think what matters to you question does, it brings together the best of both worlds. It brings together the wonderful advances that we've made in treatments and technology in healthcare and social care, and it helps us then to connect those to the human being, the individual that's in front of us. And one of the pieces of other pieces of work that it's what matters to you connected me to was something called Intelligent Kindness, and a publication by Penelope Ballett and John Campling. And they talk about this circle of person-centered care. And what they identified at the top of the circle is the importance of being attentive, of listening. And so what matters to you does, it helps us to start at the beginning, at the most important place, which is to be attentive. And when you're attentive and you listen to someone, you then move round to the next place, which is to become attuned, to understand them a little more. And when someone, you'll have experienced this yourself, when someone asks you a question and they're really sincere and they ask you that question about the things that are really important to you and they listen, that's a very powerful bond that then is created between those two people. It builds trust. And we know that when you have trust, you then have this thing that's described in the literature as therapeutic alliance. And it's a very technical sounding word, but really what it's talking about is a bond between two human beings, a bond that's founded on trust and on mutual understanding. And we know that even if you're the best technical care provider, if you don't have this trust, if you don't have this therapeutic alliance and understanding, then you won't get the best outcome for the person. And we know that where this trust does exist, where this bond between the two human beings, the nurse and the patient, the physio and the patient, the doctor and the patient, where that bond exists, even though they might do exactly the same technical intervention, where this bond exists, you get better outcomes, fewer problems, and so on. And then that whole circle is reinforced because it builds kindness into the system, into society. And when you're feeling kind and connected to people, you're going to listen to them, and so on. So I think this is why what matters to you is a very simple phrase. And it's not about asking those words. I think we've discovered that. It's about, this is a way of connecting with people and having a bond between people. So when we started to do this, we found these great things started to happen. So I was working in intensive care at the time. And so we said, well, let's try and do this in intensive care. Let's try and ask the question, what matters, not what matters to you, because it was this was a little bit before that we got those words, but this is, what are the most important things for you today? But it's the same question, just in a slightly different way. And we suddenly discovered, even in intensive care, where people were very unwell sometimes, they were still able, or their family were able, to tell us what were the things that were really important. So, and we found, like Anders, people didn't ask for difficult things. This one I have on the screen here, the request from the family was, please keep my dad's eyes nice. They look red and sore. That's not difficult for us to do that. And the family feel they've had some opportunity to contribute, and the whole, the nurse hasn't had to go out of her way to make this happen. And everyone feels better about what's going on. But we also found even more complex things. So, this gentleman in the picture here, he wanted to go to the shop and buy a newspaper. And he'd been in intensive care for many weeks. He'd had a bad pneumonia. And because we had some technology that helped us to do it, we were able to get him up out of the bed and take him down on his ventilator to the shop. Now, one of our technical care goals was to mobilize him and get him out of bed. What his goal was to buy a newspaper, but there was a kind of an alignment there of these two goals. And we were working together as a team. And that the what matters to you type of conversation helped that to happen. So that was very powerful. That's a little experience from intensive care. These two people on here are my colleagues from Scotland, Jennifer at the top and Geraldine at the bottom. And Jennifer took this concept into children's nursing, and she asked the children to make a poster of the things that mattered to them. And we'll talk more about Geraldine in a minute. And this is the sort of thing that the children did. So you can see here what Jennifer's colleagues said was, they'll just ask for sweets and they want their computer to play games and so on. We know what the children want. But actually what the children asked for was very different. You know, you can see this boy here has asked for no moaning. So, you know, he wants people to be positive around him. Please knock before you come in my room. He wants to be respected and his privacy to be respected. Help me. Have activities for me while I'm stuck in bed. Don't forget about me. So you can see there's lots of things here that connect you to the person and the things that are important around this person, to their being, which we often forget, especially in hospitals, but not just in hospitals. So I think that What Matters to You helped us to discover with the children what we didn't know. There's some of these children's posters where they have, please make sure I get the right medicine. Who knew children were worried about medication safety? You know, so we're reminded of the things that are important. And there are some wonderful examples of posters where we discovered things about children that we would never have known had we not had this conversation, which enhanced the quality of their care, the safety of their care, and the relationships around their care. My colleague Geraldine, she took the same idea into older people's care in hospitals in a dementia unit. And just a simple poster like the one you see there, what's important to me? And this story is of a lady who came in very agitated with dementia. She was trying to climb out of the bed all the time. They were really worried she was going to fall and hurt herself. And she didn't have any immediate family, but eventually a niece came to see her. And they said, we asked this question, what's important? Can you help us to do this for your aunt? And she said, well, yes, of course I can. And so they went through some of the things that she knew her aunt liked and didn't. And she said, oh, one thing, she always has her rosary beads in her hand. She never puts them down. And they were like, oh, where are they? Nobody knew. And they'd been tidied away into the locker beside the bed. And so they took them out of the locker and they gave them to the lady. And she calmed right down. She stopped trying to get out of bed. She stopped trying to get out of the chair. Now, they had been having to have a nurse sit by her bed 24/7 before they knew this. And so you can see how the safety of her care was enhanced, the costs of her care were enhanced, and the quality of her care was enhanced by asking this simple question and discovering what we don't know. That's the thing. Discovering what we don't know about the people that we care for and support. So this was a really powerful experience for us. This is a little taste of what we've been doing in Scotland, and then Anders, we connected because of What Matters to You Day, Anders, with people from all over the world, and this was a Norwegian idea. Maybe I should hand back to you, Anders, to talk a little bit about What Matters to You Day, this idea that you had.
Yeah, because it started actually because we really needed to strengthen the message in our learning collaboratives, and then we came up with this 4th of June 2014 day. But it came again in 2015, growing, with a health minister supporting our day, which was quite important, I think. But it was very much a local day. We invited the collaborative to take this day and use it the way they wanted. I was in Scotland in 2015 talking about our approach with the learning collaboratives, creating pathways, and challenged the Scottish healthcare to join us in What Matters to You Day, and so you did. You were invited to take responsibility in Scotland, and we were connected. And in 2016, I think we were 12 or 13 countries the first time.
Yeah.
And it was such a wonderful experience, how open people were to join us, supported, as you can see, from different angles. So it started with seeds, our small experiences in Norway and in Scotland, and we really were impressed about how this was taken from other countries. I would like to introduce to you a different way to look at it. I remember when I was a leader of an institution for old people, I learned about fire safety, prevent fires, and we learned about what start fire. So what do we need to start a fire, keep it alive and spread it? And I found that quite interesting to go into those details to understand how we could spread What Matters to You Day. So if you see here, you see the 3 things that you need to start a fire. It's a burning material. It must be real and have potential. And then it's heat. We must believe in it and have the passion for it. And then it's oxygen, repeated attention and refills. And then after a while, I learned something new, and that's the fire square that explains how some fires really explodes. And that is a chain reaction you reach when you have the perfect balance between the 3 first, between the burning material, the heat, and the oxygen. So I think, Shaun, this is kind of what happened when we started talking about What Matters to You Day together with other healthcare systems, other countries. Don't you agree?
Yes, that's right. And so what happened then was we found ourselves suddenly in demand, and around the world, various different places, having the opportunity, a great privilege really, to be able to connect with many people around this message of what matters to you, and all of the changes and the difference it makes to people's lives and to the people who work in the healthcare system. So for a number of years now, we've been going to the National Forum in Orlando, where we have been connecting with people from all over the world in wonderful ways about what matters to you, and growing this movement. And we've made some incredible connections and some good friends. Some of them a bit crazy as well, as you can see here. But also really the interesting thing is that people from different cultures, this cuts across. You know, the actual phrase "what matters to you" might be a bit difficult to translate those English words into other languages, but what it means is common and universal to human beings. The connection between 2 people, the bond of trust, the shared vision of what matters, and getting the opportunity to live the best possible life in the most meaningful way for you. So then we also we've had some opportunities at the International Forum in Glasgow, and again this year we had a virtual What Matters to You session for the Copenhagen Forum, where a number of us from around the world who have been doing some work with this were able to connect and share the message with a group of people. And we've been even halfway around the world. Anders and I went to ISQA, the International Society for Quality in Healthcare, to Kuala Lumpur in 2018, where we had a very interesting experience in not only connecting with the incredible people from very different cultures and a different community of people perhaps around the world, but also to experience some of the culture there. Even the guys in the background of this last picture here goofing and making fun of us in the picture in the airport before we left.
And this was together with Gro as well, because she was also part of both the session we had, and we had a great dinner together, and yeah.
And then Anders, maybe this was your experience.
Yes, it's unbelievable. I was asked by BMJ to join a patient safety conference in Jeddah in Saudi Arabia. And as you can see here, it was a completely different experience when it comes to culture. But I had a workshop, half a day workshop together with Dr. Elam Bukhari, and a wonderful woman who really, really connected with me on the same ideas, the same values, in this change of direction I was talking about earlier, and to get more health promoting in our health service. And yes, it's me in that costume.
And I think that one of the things I remember you sharing with me, Anders, about this experience was your initial reaction was, this is so different to my world, to my culture, yet there was still that same connection on this issue,
Yeah.
which is fascinating.
Something special to see that we are unified by these values and this direction that the question, what matters to you, raise.
Yeah. So one of the things that we've tried to do with this is understand, well, in some ways I had been, in some of my quality improvement work, have been looking at social movement theory. And we tried to, in Scotland with the work, we tried to apply some of this thinking, the work of Marshall Gans and others, to how we spread this movement, because it's not about numbers and counting, it's about people and connections. And just to explain a little bit around why we think this has been able to spread in the way that it has. And one of the things that Marshall Gans talks about in social movement theory is connecting the heart, the head, and the hands. And so one of the things that's been very central to the What Matters to You movement is the power of storytelling. So we have data and the sort of traditional metrics you might have in healthcare, but often those don't detect the signal, the change that comes from having this conversation. But human stories do, and can very powerfully illustrate the difference that this makes in people's lives. Also, it connects with the values that many healthcare professionals have, but actually that human beings have. To want to honor and respect and to connect in a meaningful way with others is a very central part of what it is to be a human being. And the third thing to recognize is that change is often an emotional thing. It's not often a logical thing. We like to think we're logical and rational and that we change always based on, very rational and objective criteria. But actually there is, and it's not a bad thing, that we often need an emotional reason to change. We need to have something that we feel passionate and believe in and that's important to us. And I think that what matters to you, especially the stories that we tell, the case studies, if you like to use different language, that we look at to illustrate what matters to you, are the powerful catalysts which help people to change. So then we think about the head side, the more logical elements, and then we think about, well, and you see this very clearly with the work Anders has described with the pathways work, how we start to think, okay, so how do we make this part of our day-to-day work? And so we think about the outcomes and the things we might measure. We think about the networks we can link into. We think about the traditional structures that we have, the hierarchies and the people who can help to influence. We think about what the priorities are of government, of communities, and of individuals, and we align and use language that helps to connect with these things. And this is maybe this is the most important one, the hands. What we have with the What Matters to You movement is we have something that you can take away. You don't need to find 10,000 krona. You don't need to get the permission of your boss. There's nothing to stop you tomorrow going and having a conversation with this different focus, with a person, with a patient, or with a colleague even. You can go and do it tomorrow. It doesn't cost you anything. It's just about a change of direction in terms of our relationships and our way of working. So I think that these three things together, the stories in connection with what matters to people who work in healthcare, looking at the things that are already happening and aligning and working with those things rather than trying to turn it all on its head, and then also giving people something they can actually touch and feel and start to do straight away is really important. So here's the summary, if you like, of that. Focus on the things that matter, the essence. Welcome anybody who wants to participate, all comers, and be open to that. Think about both the social networks and the hierarchies. Use storytelling and go with the energy. So anybody who's enthusiastic, who has a spark in their eye, then welcome them and work with them. So those are some of the thoughts we've had around why this movement has spread in the way that it has. Anders, maybe back to you. Oh, you're on mute, Anders. It wouldn't be a proper Zoom call if we didn't have somebody on mute.
Sorry. Well, this picture shows our dream, actually. You know, the first plant, the seeds, when you blow on it and it spreads like this. So what we see is really tsunami changing healthcare around the world, not because of our work, but because so many people have their eyes on this need of a change. And I think this is a lovely picture, and it sure gives us an inspiration when we see it together with, together with this picture, because it shows the 50 countries participating in What Matters to You Day in 2020. The year when we look at the COVID-19, think we should be in fair zone, as you can see in this model, inspired by Senningers learning model. I got it from Damara, our wonderful colleague at the Montefiore Hospital, Hudson Bay, New York. And she showed us this to describe how they felt in April with the fair zone and the need of going from the fair zone to the learning zone, and then really bring the best experiences we have to the growth zone. And I really have this dream that we actually can see that we grow through these hard times and learn that what matters to you is maybe even more important now when we see isolation, passive elderly. You see the need of the what matters to you approach to create better health again when the pandemic slows down. And hopefully we could have a stronger service, healthcare service, not sick service, when we get on the other end of this pandemic. Okay, Shaun, this is the last picture. Bringing it home, well, what matters when it's really getting close to me. This was something I wrote on behalf of my mother when I was sitting the last 6 days of her life at the bedside, holding her hand. And I could see actually nurses in January in 2018 wearing those badges you see there in the corner of the picture of our hands. And to experience that in my hometown, to see my mother get the care that grows out of the question, what matters to you, and being able to only be the son and not the carer, not the professional, but to be her son, following her the last days of her life. And that was the most wonderful experience I can imagine, to see that this global movement that we have been trying to talk about for this short time with you, maybe a long time, I'm not sure, and to experience that it really hits when I'm at the weakest and most vulnerable, and see that it strengthened the healthcare in providing healthcare service to my mother. And I'm so grateful for that. Thank you for listening to us.
Yes, thank you very much. And keep that focus on what matters. It keeps you on the right path, as Anders has shown there. It's just so powerful. So thanks, Anders, for sharing that as well. And we're just sorry we couldn't have been with you in person, but maybe next time. Yeah, maybe next time. So thanks very much, everyone. Great.
Thank you.